going to
Action.
be cleaning the patient's tracheostomy site. So, first thing I'm going to do is verify the order, assemble the equipment that I need. So I'm going to need tracheostomy clean and care tray, some gauze sponges, some normal saline, and some hydrogen peroxide. I'm also going to need some non-sterile gloves. Are you sure? Alright, and now I'm going to get started. I'm going to wash my hands, introduce myself to the patient, identify the patient, so there's 2 forms of identification. I'm also going to assess for allergies at this point. So I'm going to provide for privacy and explain the procedure. I'm just going to change the dressing and if the patient has questions at this point, I will answer them, and then we'll get started. So, the patient is currently on oxygen. I'm going to put on non-sterile gloves, and I'm going to assess the patient's tracheostomy site as I remove the soiled dressing. So, in this case, this young lady, I'm going to take that split gauze off, dispose of it, and observe for signs of redness, secretions, etc., etc. I'm going to take off my dirty gloves, and I'm going to wash my hands again. Now, at this point, I'm going to go ahead and loosen my caps, and I'm going to assemble my sterile field. So, for sterile field, I'm going to get this closer to the patient. That way I can keep the patient and my sterile field in my line of sight. I'm going to open up my tracheostomy care kit. And I'm going to go ahead and open my gauze sponge kit. Okay, now at this point, take these gloves out. Okay. Now, one inch border is contaminated.
Did you want to get the other ones?
Yeah. And I'm going to sterile glove.
Sterile glove. She's sterile gloving right now. Notice how she has the boxes already to the side before she starts sterile gloving.
Okay, now, my hands are sterile. I'm going to remove that from my sterile field, or my table where I'm going to prepare my sterile field. I'm going to take this drape out of the box, unfold it, and then I'm going to place it shiny side down on my table. Okay. I'm going to take my treasures from the box and pile them in the center of the sterile field. I'm also going to take about half of these gauzes and put them in the field as well. Now, I have to dirty my hands, so I'm going to use my left hand.
Do y'all have a pair of scissors?
Yes. They're in my pocket.
Doing this without breaking sterile field. Bonus point. Remember to rinse, maintain sterile field, and then what else? Okay.
Why'd you do it like that?
Do it like what?
Went around instead of just pouring it on top.
Because this is not sterile. I don't want to put a contaminant over my sterile field.
Good idea.
And then we close this bad boy back up and move that out of the way. So at this point, this is my workspace. So I'm going to move over here, take the patient's oxygen off, and use my left hand to take out the patient's inner cannula. I'm going to place the inner cannula in the reservoir with the hydrogen peroxide. Then, using my sterile hand, I'm going to take this Q-tip, dip it in saline, and clean the outer cannula. Then I'm going to take a clean swab and dry it. Great. Then I'm going to go back over here to where my inner cannula has been soaking. I'm going to use my dirty hand to pick it up by the green part. I'm going to hold it away from my sterile field and use my brush to clean it. Okay, at this point I'm going to know if there's a hole in it. Realistically, there won't be a hole in it. I'm also going to just scrub it really good. Okay, also if there's any crusties up here, scrub those off. Throw that away. Move this to my normal saline reservoir to rinse. Okay, once it is rinsed, I'm going to pick it up using my dirty hand. And I'm going to dry it off using this gauze, like so. And I'm going to dry the inside of it using this pipe cleaner, like so. And I don't want to leave any peroxide in there because peroxide has a bubbling effect and we don't want to put that into our patient's lungs. So, the clear part of the cannula is still sterile because that's the part going back into the patient. At this point, I'm going to take it and replace it into the patient's outer cannula, and I'm going to lock it. Okay, at this point, this hand is still sterile, this hand is dirty. I'm going to use my sterile hand with normal saline, and I'm going to start cleaning quadrant by quadrant around the patient's trach. And I'm not going to touch my hand against that site. Now this hand is dirty, so I'm going to use it to push the patient's gown out of the way. Then I'm going to dry. One, two, three, four. Okay, at this point, I no longer have to be sterile. My hands are filthy now, so I'm going to take these dirty, boogery gloves off. And I'm going to put clean, non-sterile gloves on.
I gotta go because I have to be at Ken's meeting from 12 to 1, so I won't have a lunch.
Do you want me to bring you something?
No, I'm gonna go. But I'm not gonna watch anybody else.
You got 30 minutes. We're almost done here.
Yeah.
Okay. So now, I'm not sterile, but I don't have to be sterile. I'm going to take this split gauze and I'm going to place it around the patient's business.
Mm-hmm.
And take this.
Were you gonna hold this? I'm gonna go ahead and fill out her thing about what she did good and what she did bad.
Yes. No.
Lift that head up. Do we just tie that in knots? Okay.
Now,
You have scissors with you? Oh my god.
we don't want to leave these strings too long because we don't want to let them get into the patient's cannula. So I'm going to trim those first because they are the most present danger.
Really?
Yep. Because we don't want to let them get into that cannula.
Yep.
Then I'm going to cut off okay.
Perfect
And
job.
I'm going to replace her oxygen. I'm going to throw away all of my crap. I'm going to document what I did it with, and how the patient tolerated it. And document quantity and quality of her secretions. And I guess that's it.
That's great.
Okay.